Have you ever asked your doctor about the risks of a so-called routine exam, only to feel your question brushed aside or left unanswered? Hildegard was 73 years old when she walked into the hospital for what was described as a simple precautionary test. Her doctor called it routine, nothing to worry about. Yet only 3 days later, she was gone. During a colonoscopy, the walls of her intestine, already fragile with age, were perforated. Internal bleeding set in, and despite the efforts of the medical team, she did not survive. What for a younger patient might have been an inconvenience became, for her, a fatal complication. This story is not told to frighten you, but to illustrate a critical reality. Medical procedures that appear safe in midlife can carry very different risks after 60 or 70. At that stage of life, recovery is slower, tissues are thinner, and organs less resilient. The very same tools that help a 40-year-old may prove dangerous to someone twice that age. Seniors deserve to know that difference before they agree to any procedure. Before we go further, let me be clear. This video is for educational purposes. It is not a substitute for professional medical advice, diagnosis, or treatment. Every person's situation is unique. Always consult your own physician before making health decisions. What we aim to do here is give you awareness, so that when a doctor suggests a routine test, you feel empowered to ask the right questions, to consider safer alternatives, and to make choices with open eyes rather than blind trust. In the sections that follow, you will learn which procedures become riskier with age, why that risk increases, and most importantly, what you can do to protect yourself. Why do these risks rise so sharply after 60? The answer lies in the natural changes that aging brings to the body. As we grow older, our tissues lose elasticity. Blood vessels stiffen and become more fragile. Healing takes longer, and the skin thins. The immune system is less robust, making it harder to fight off infections. Organs like the kidneys and liver, which process medications and filter toxins, often work at only a fraction of their former capacity. All of these shifts mean that procedures considered low risk in younger adults can suddenly tip into the category of dangerous for seniors. Take the example of anesthesia or contrast agents used in scans. In a 30-year-old, the body metabolizes these substances efficiently. In a 75-year-old, the same dose lingers longer, interacting with other medications and stressing organs that are already under strain. A minor complication, slight bleeding, a brief drop in blood pressure, may be shrugged off by someone in midlife, but can destabilize an older patient for weeks or even months. The situation is made worse by how information is presented. Consent forms are filled with complex terminology, printed in tiny letters, and often handed over in a rush. Many seniors, out of respect for medical authority, sign without fully understanding. What they rarely see are the statistics that matter most, how much the risk multiplies with age. In some cases, the rate of serious complications is not just slightly higher, but 20 or 30 times greater. This is why awareness is so important. Knowing how age changes the equation gives you the power to pause, to ask, and to decide with clarity rather than assumption. Behind the curtain of every hospital and clinic lies a reality that few patients are ever told. Procedures are not only medical interventions, they are also revenue streams. Colonoscopies, heart catheterizations, contrast-based scans, each generates hundreds or even thousands of dollars. For healthcare systems under financial pressure, recommending more of these tests can seem like good business, even if the benefit to the patient is questionable. That does not mean every doctor is acting with bad intent. Many genuinely want the best for their patients. But the structure of the system creates powerful incentives that can lead to overuse. Official statistics often understate the dangers. Complications and deaths are sometimes coded in ways that hide their connection to the original procedure. Families may be told that age was the cause, without hearing that the test itself carried unusual risks for someone in their 70s. Meanwhile, guidelines written for younger populations are applied broadly, without adjustments for seniors. A 75-year-old metabolizes drugs, heals from wounds, and withstands anesthesia in profoundly different ways than a 35-year-old. Yet in practice, those differences are overlooked. There is also the weight of legal liability. Ironically, physicians often face fewer consequences if they perform an invasive test that ends badly than if they decline to act and a problem is later discovered. This culture rewards action, even unnecessary action, while punishing caution. For older patients, that can translate into being steered toward interventions that add risk without adding value. Recognizing this systemic pressure helps explain why so many seniors undergo tests they may not need. It is not about distrusting every doctor. It is about understanding that the environment shapes the advice you receive. By being aware, you can bring balance to the conversation, asking whether a procedure is truly essential for your health or simply routine for the system. The first of these procedures is the colonoscopy. In middle age, it is widely promoted as a vital screening tool for colon cancer, and for many, it can indeed save lives. But after 70, the equation changes dramatically. The walls of the intestine thin with age, making them more prone to tearing. A single slip of the scope can perforate the bowel, spilling its contents into the abdominal cavity. The result is peritonitis, blood poisoning, and in many cases, death within days. Statistics are sobering. While younger adults face a perforation risk of less than 1 in 1,000, seniors over 75 face a risk closer to 3 in 100. Add anesthesia into the mix and the danger compounds. Sedatives that calm a younger patient may trigger irregular heart rhythms, sudden drops in blood pressure, or even respiratory arrest in older bodies. Ernst, a 78-year-old from Munich, learned this the hardest way. Though hesitant, he agreed to the test after reassurance from his doctor. Within hours, he suffered a bowel perforation. Emergency surgery lasted 8 hours, but it was not enough. What was meant to be routine prevention became a tragedy. The second procedure is the heart catheterization. Here, a thin tube is threaded through blood vessels to the heart, usually to check for blockages. In seniors, however, arteries are often calcified and brittle. The catheter can dislodge hardened deposits, sending them into the brain as emboli, causing an immediate stroke. Bleeding at the insertion site is also harder to control in older adults with fragile skin and weak clotting. Even the contrast dye used during the test can overwhelm aging kidneys, triggering sudden renal failure. Studies reveal that nearly 5% of patients over 75 suffer strokes during or shortly after catheterization. Thousands die each year, often after being rushed into the procedure with the warning, "If we don't do this now, it might be too late." What makes these outcomes more tragic is that safer alternatives exist. Non-invasive options such as stool tests for hidden blood, capsule endoscopy, echocardiograms, or stress tests can provide valuable information without the same risks. A CT scan of the coronary arteries, in certain cases, offers clarity without catheters. Before agreeing to invasive diagnostics, seniors should always ask, is there a safer way to get the same answer? Often, the answer is yes. The third procedure to approach with caution is general anesthesia. In younger adults, anesthesia is often a brief interruption, forgotten once the operation is complete. But in seniors, the brain responds differently. The protective blood-brain barrier becomes more porous with age, allowing anesthetic agents to linger and disrupt normal nerve activity. As a result, nearly 1 in 3 patients over 75 experiences what doctors call post-operative cognitive dysfunction, waking up disoriented, unable to recognize family, or unable to form new memories. For many, the fog lifts after days or weeks, but for around 12%, the damage is permanent. What was once a fully independent older adult can become someone who struggles with dementia-like symptoms after just a single surgery. Margaret, an 81-year-old in Berlin, entered the hospital for a minor hernia repair. Physically, the procedure succeeded, but when she awoke, she no longer recognized her daughter. 2 years later, she lives in a nursing home, her independence gone. Not because of her hernia, but because of the anesthesia that was supposed to make the operation easier. The fourth procedure involves contrast-based imaging, CT scans with iodine dyes, MRIs with gadolinium, and angiograms. These substances illuminate organs and vessels on the screen, but in older kidneys already strained by age, they can be toxic. Roughly 15% of seniors over 75 develop kidney injury after such exams, and a smaller but significant fraction never recover, requiring dialysis for the rest of their lives. Severe allergic reactions are also far more common in older patients, sometimes leading to sudden shock. To make matters worse, gadolinium used in MRIs can accumulate in the brain and other tissues, with uncertain long-term effects. What makes both anesthesia and contrast imaging particularly troubling is that alternatives exist. Many surgeries can be done under local or regional anesthesia, sparing the brain unnecessary strain. Ultrasound and non-contrast MRI often provide clear diagnostic pictures without exposing the kidneys to risk. If contrast truly cannot be avoided, protective steps, drinking plenty of fluids, checking kidney function beforehand, and sometimes taking protective medications can dramatically reduce harm. For older adults, knowledge of these safer pathways is crucial. They do not eliminate risk, but they can tilt the odds back towards safety and preserve quality of life. If all of this sounds overwhelming, remember that you are not powerless. There are practical steps you can take to protect yourself whenever a doctor suggests an invasive test. The most important tool is a set of 5 questions, simple, direct, and life-saving if you use them consistently. First, what is the specific risk for someone my age? Not the average risk, not the number from the general population, but the percentage that applies to a 75-year-old body. Second, what alternatives are available? Often there are safer methods, an ultrasound instead of a CT with contrast, a stool test instead of a colonoscopy, or regional anesthesia instead of general. Third, what happens if I don't have the procedure right now? Many so-called urgent tests can be postponed without changing the outcome. Fourth, does anyone here benefit financially from this procedure? This may feel uncomfortable to ask, but it uncovers hidden incentives. And fifth, would you recommend this same test for your own parent at my age? That question appeals to the doctor's human side and often reveals more than statistics. Asking these questions is powerful, but applying them requires strategy. Bring a trusted family member or friend to appointments. 2 sets of ears hear more than one, and a companion can step in when emotions run high. Always request information in writing. A doctor who hesitates to provide written explanations may be glossing over risks. Take time to think. Except in genuine emergencies, you are entitled to a pause before signing. Seek a second opinion if you feel pressured. A good physician will never discourage that. And when you research on your own, rely on reputable sources, not rumors. Consider this scenario. A 70-year-old man was urged into a heart catheterization after reporting mild chest discomfort. Instead of rushing, he and his daughter asked the 5 questions. They learned that a stress test could provide nearly the same information without the risks. He chose the safer option, and the test confirmed his heart was stable. By asking, pausing, and exploring alternatives, he avoided a procedure that could have harmed him unnecessarily. That is the kind of empowerment these questions can bring. We have now walked through 4 medical procedures that are often described as routine, but can carry serious risks once you are past 60 or 70. Colonoscopies that may tear fragile intestines, heart catheterizations that can trigger strokes or kidney failure, anesthesia that clouds or even permanently damages the mind, and contrast-based imaging that silently injures kidneys or provokes allergic shock. Each has its place in modern medicine, but each must be weighed differently as we age. The essential lesson is not to reject every test, but to approach them with awareness. Aging changes the body in profound ways. What is safe at 30 is not automatically safe at 75. By asking the right questions, by insisting on clear explanations, by exploring safer alternatives, you transform from a passive patient into an active partner in your own care. Remember those 5 key questions. Write them down, keep them in your wallet, and take them to every appointment. Bring a trusted companion, demand written information, and do not let anyone rush you into a decision. Knowledge is not a shield against all risk, but it is the single most reliable defense against unnecessary harm. If you found this information valuable, share it with friends, family, or anyone over 60 who might benefit. You may give them the awareness that saves their health, or even their life. And above all, carry this with you. Your voice matters, your choices matter, and with the right knowledge, you have the power to protect yourself.